And it's a very appropriate time to be making this announcement, given that it is National Nurses Week. This week is a great opportunity to recognize the incredible registered nurses, nurse practitioners, and registered practical nurses across our healthcare system, and especially in long-term care. These heroes are the backbone of the long-term care system, and they do vital work every day so that our loved ones receive the quality of care that they need and deserve. Last December, we committed to ensuring residents receive, on average, 4 hours of direct care per day. This is an ambitious commitment, and it will make Ontario the leader in Canada. To make this a reality, tens of thousands of new staff need to be hired to provide the care that's necessary for our loved ones, and that can't happen overnight. That's why Ontario is investing $4.9 billion over 4 years to increase the average direct care to 4 hours a day for our loved ones in long-term care. We will also hire more than 27,000 staff, including registered nurses, registered practical nurses, personal support workers, allied health professionals, and support staff. So we've been moving as quickly as possible to implement our plan and fix the long-standing staffing problems in long-term care. Since announcing our historic plan, we've made a number of investments to help ensure that we have the levels of well-trained staff that we need in long-term care. These investments total over $200 million and will help train up to 16,500 new PSWs at Ontario's publicly assisted colleges, private career colleges, and district school boards. Many of these schools have already begun accepting applications, and students have started their training. So today, we are taking another major step to implement our staffing plan. We are investing an additional $35 million to increase enrollment in nursing education programs across Ontario. This investment will support the training of up to 2,000 new registered nurses and registered practical nurses who can work in our long-term care homes. It will also increase clinical education grants for colleges and universities to support the additional nursing students. And it will improve supports for clinical education placements for nursing and PSW students in long-term care homes in the following ways. It will support training for preceptors. Preceptors are the individuals who oversee students in their clinical placements, and this funding will support an increase to both the quantity and the quality of placements in the long-term care sector. It will also provide funding so that these preceptors can dedicate time to student learning rather than supporting students on top of a full workload. The nurses that will be trained through today's announcement are critically needed. The demand for nurses has been growing steadily for years, and COVID-19 has only exacerbated this issue. This announcement will help us keep pace with the rising demand for frontline healthcare workers. It will also make long-term care a better place to work. Increasing staffing helps address the workload issues that, after decades of underfunding, have become too common in this sector. Being a nurse is meaningful and rewarding work. Having worked as a family physician for almost 3 decades and as a daughter of a parent who spent time in long-term care, I deeply appreciate the support that nurses provide. And over the years, I've heard countless stories from residents and families expressing how important nurses are in their daily lives. We need you, and our loved ones need you. And to the nurses already working in the healthcare sector, thank you. You are there every day, providing tireless support to our most vulnerable. Through this investment and many others, we are addressing the long-standing staffing challenges that have impacted the long-term care sector. We are delivering on our commitment to ensure that residents receive, on average, 4 hours of direct care per day. And we are making long-term care a better place for residents to live and a better place for staff to work. Thank you. I will now hand it over to Minister Romano.
Thank you very much. Good morning, everyone. And thank you so much, Minister Fullerton, for that very kind introduction. It's so great to be here with you all today for this extremely important announcement. Ontario is facing a challenge in our long-term care system. And as Minister Fullerton has just outlined, we've been taking steps in collaboration with our publicly assisted colleges and our universities to be able to train more registered practical nurses and more registered nurses in Ontario. We recognize the challenge that we face, especially in our long-term care sector, to have more frontline healthcare workers. And if we want to be able to increase the supply of healthcare workers in our province, we have to be innovative and we have to be collaborative. Our post-secondary education sector, as you've heard me many times say this before, we are one of the best in the entire world. Our colleges, our universities, all of our sector are absolutely incredible at being innovative and flexible to deliver outstanding education. And if this year has taught us anything, what we've learned is that through innovation and flexibility, we can improve the way we educate and train our workforce. And I think we've done an exceptional job at this over the course of this last 14 months now through COVID-19. It's been such a challenge, but we've been able to get all of our students through. We've been able to continue to be innovative and flexible. And just over a year ago, we looked squarely at this concern that we had with our health human resources, specifically when we're looking at our long-term care sector, the challenges there that Minister Fullerton has been working so hard on to try to address the challenges and the capacity and the health human resources we have. And we started this mission well over a year ago to try to ensure that there was greater pathways for students to become nurses in this province by creating the first opportunity for colleges here in Ontario to offer standalone nursing degrees. That was a great start that allowed more pathways for students to be able to take nursing programs across Ontario to be able to deliver the health human resources that we need in our long-term care and our health sector all across this province. And there's something very special to me as a Northern Ontario resident, someone from Sault Ste. Marie. I often say in my community that we want to find better ways for our young people to be home to stay home in their communities, especially in some parts of the province where there are other challenges with being able to receive this education. Being able to do that, the pathway through the college baccalaureate nursing program now provides that easier access for students across all of Ontario to be able to stay home in the community that they want to be able to stay in on and be able to continue to contribute to the excellent pathways to awesome careers in the health human resources field. I have all the confidence in the world that our colleges and our universities are going to be able to provide the high quality education that we need to be able to create those opportunities again for people across our province and to be able to really help address the challenge that we have in the long-term care sector and really right across our entire healthcare sector of the lack of human resources capacity there. We need more PSWs, we need more nurses, and we've been working so hard, and Minister Fullerton has done an outstanding job. And I really want to give a huge thank you to you, Minister, for the outstanding work you've done on this file, and really to demonstrate that we had a challenge, but we are overcoming that challenge as we continue to work towards being able to create more registered practical nurses and registered nurses in Ontario. If you look at since the start of COVID-19, we've had a 70% increase in students applying for nursing courses here in Ontario. That is such a significant increase that we've seen. And by being able to work directly and collaboratively with our stakeholders within the sector to ensure that we were in a position to train more nurses, but in a way that would ensure that the quality of that education would not be in any way compromised, to ensure that the sector, the stakeholders knew that they would be able to deliver at this level. These numbers were not picked out of thin air. The numbers that we came up with were the numbers that the stakeholders outlined for us as being the numbers that we needed and we could meaningfully deliver now. And this is such great news. And when we look at the previous announcement that Minister Fullerton outlined already, almost over $86 million that was spent to be able to increase our personal support workers by 8,000 through a program with our private career colleges, then another program with our public colleges for $115 million investment to create 82 new 8,200 new positions of PSWs in the province. There's so much that's been done. It's so hard to put it all into one announcement like this. And that's why you've seen so many of these. So I just, again, want to reiterate my thank you to Minister Fullerton for the great work, and to all of our healthcare workers out there who have been working so hard through this pandemic and prior, obviously, and will continue to work so hard for all of our loved ones, for those in long-term care. Thank you for everything you're doing. Thank you for continuing to show resilience and demonstrate that resilience with that 70% increase in applicants. That's outstanding for our nursing students across this province. This is a great demonstration of our Ontario spirit, and a great demonstration that we really do work better when we work together. And I'm so excited to be able to be here with you, Minister, today to celebrate this announcement. And I will now turn it over to the President of Colleges Ontario, Linda Franklin, to say a few words. Thank you, Linda.
Well, thanks so much, Ministers Romano, Minister Fullerton. I'm, on behalf of the college system, just delighted to be here today to pay tribute to this important investment in Ontario's nursing programs. You know, the new funding announced today will absolutely strengthen the healthcare workforce through the province. It ensures we'll be able to enroll more students in nursing programs, and it will significantly expand that workforce in every community of our province. You know, it's a critical investment at this moment in time in the future of our communities, as well as in the quality of care across the healthcare system, including long-term care, home and community care, and acute care. So thank you for this tremendous news today, and the collaboration that Minister Romano mentioned that went into getting us here. The Ontario government, you know, continues to be a really strong champion of our colleges and the excellent nursing programs that are offered there. So, you know, as Minister Romano has mentioned in his remarks, even before the pandemic began, the government recognized that there's a significant demand for more nurses in many communities and worked with us to fill that demand. In fact, one of the most significant announcements in post-secondary last year was Minister Romano's decision, in conversations that started with Minister Fullerton when she was our minister, to give Ontario colleges the option to offer independent nursing programs along with those offered jointly with the universities. Today, that decision will help us meet the need for more registered nurses in Ontario's healthcare system, and we are truly grateful to be able to meet that call. In many communities, it will enable colleges to attract students who have wanted to pursue nursing for a long time, but don't want to leave home to do that. And it will mean that more of our students will graduate into jobs in nursing in their home communities. Already, there are wait lists that are full of students wanting to become nurses. And opening up these spaces will help ensure that our province can meet the nursing demand that it has and allow more students to realize their dream of being nurses. We're very grateful for the excellent support we've received from the government, which we can see once more in this announcement today. And we stand ready to help address the health workforce needs of the province going forward. So thank you to the government and to our ministers. And with that, I'm going to turn it over to my colleague, Steve Orsini, the President and CEO of the Council of Ontario Universities. Steve.
Thank you, Linda. I really appreciate your ongoing support, and I would like to begin by thanking Minister Romano and Minister Fullerton for inviting me today, and for all the support we got as part of the long-term care staffing working group. And that group had a lot of key partners, including Colleges Ontario and the RNAO. Both ministries have provided tremendous support to us in addressing the critical shortage of nursing in Ontario. And we are very grateful for the support we've received in really addressing the acute care needs in the sector, not only in home care, long-term care, but also hospitals. We've been very fortunate to have a tremendous increase, as the minister mentioned, of a number of students expressing a desire to work in nursing. And that's a testament to the spirit of our students who want to dedicate their career to nursing in Ontario. We've seen with the pandemic how difficult it's been. And the fact that we've seen more and more students have indicated their support and their interest and really helping us cope with the pandemic is really a demonstration of the Ontario spirit. And so we're thrilled to be part of today's announcement. We know universities across Ontario have been doing everything they can to support the province, opening up vaccine clinics on campuses, having researchers and scientists, tackle the complex issues around the pandemic, and students providing care for those that need it. So we're very pleased to be here today to support this announcement. And I want to thank Minister Romano and Minister Fullerton for all their support. Thank you.
Okay, great. That concludes the formal portion of our announcement. And I would like to thank our speakers for sharing this exciting news. We will now open the session up for questions from the media. If you are a member of the media and would like to ask a question, please use the raise hand icon on your screen. When your name is called upon to ask your question, you will receive a prompt to unmute yourself. Accept the prompt and ask your question in the format of one question, one follow-up. At this time, I would like to invite Vanessa DeMatteis, Communications Advisor and Press Secretary with the Office of the Minister of Long-Term Care, to moderate our media Q&A session. Vanessa?
Good morning, everybody. Our first question comes from Alex Gouch from City News Ottawa. Please go ahead.
Hello. My question is for Minister Fullerton. A recent survey came out last week that said 40% of nurses are considering leaving the workforce due to COVID-19 and the pandemic and just the stresses that are associated with that. Do you think today's announcement is going to hopefully support that potential exodus and get more people back into the workforce?
Yeah, thank you. That's such an important question because with an aging population, of course, our workforce is aging as well. And as Mr. Orsini mentioned, there has been an increase in applications to the colleges and universities for these nursing programs, which is tremendously inspiring to think that people that are watching what's going on and want to be part of the solution. And I also think, when we bring in staff to help the staff that's already there, it is very supportive. And if you are working short staff, especially during the pandemic, you can see how devastating the situation was in our long-term care homes. All of this will help, not only to encourage others to contribute their nursing talents, but to help those that are already in the system working so hard every day. And my heart really goes out to everyone who's been part of the solution, helping our homes and our healthcare sector. So I believe that this is a very important step forward. Thank you.
Follow-up?
And for my follow-up, anyone who wants to chime in on this is more than welcome to. I've heard anecdotally that a lot of people have been actually thinking about transitioning from more like art stuff to nursing. Do you hear this more commonly right now, with people going into nursing from something completely unrelated because of the pandemic?
Well, certainly there would be anecdotal. I don't have any firm statistics on that, but it would seem possible that people would be looking at something where they can contribute and they can be of support, and understanding the growing need, the need that exists now and into the future. I can certainly appreciate the willingness of people to step forward and contribute to be part of the solution. And it is tremendously inspiring. So I would just encourage anyone to understand what an important role that they could play in the lives of others. And that's consistent with our staffing plan, a better place to live, but a better place to work for our staff, supporting residents. It's humanity. And I just appreciate everyone who's putting themselves forward. Thank you.
Thank you so much.
Our next question comes from Lorenda Redekop from CBC. Please go ahead.
Hi there, Minister Fullerton. Your notes publicized by the Long-Term Care Commission report showed that on April 17th, 2020, you said that military needed to be in the homes in 24 to 48 hours, but that didn't happen. It was days later. Apart from writing that down, what did you do? Who did you share it with and when?
Well, thank you. Thanks, Laura, for the question. I think understanding that we were using every tool, every measure possible, and asking the military to come in. Obviously, there was a devastating situation in a number of our long-term care homes. And so this had been regularly monitored throughout the pandemic since the very beginning, a whole team of people assessing the homes in terms of their risk and daily monitoring of the homes to understand where their risk was. And the staffing shortages were becoming more acute. And so this was a whole team of people. It was multiple ministries involved in the homes with public health inspectors, Ministry of Labor inspectors, our Ministry of Long-Term Care inspectors. So this was a multitude of people monitoring the homes. And we knew that COVID moves quickly. So there was an urgency to move quickly as well. We just couldn't move fast enough for COVID.
Here's still whether you did share that with anyone, whether other people in the government knew that. But I'll move on also to my second question. You can choose to answer the first in here as well.
Clear, Laura?
But
definitely shared. So I just want to be clear. To be clear, Laura, I just wanted to be sure that you understand that my response indicated that it was shared. There was a multitude of people involved. Thank you.
Great, thank you for clarifying. And the NDP has been calling for action and investigations into the long-term care homes that the military noted had deaths caused by neglect. Families obviously are also looking for answers. When did you learn that deaths were caused by neglect, and what further investigations do you want to see?
Well, we're actively working right now with the coroner's office, understanding where that information came from and verifying what happened. So we've got inspectors in 2 homes right now to understand and interview staff and medical directors and working with the coroner's office reports to understand and put this together to verify what actually happened. And it's important to understand not only what happened, but the devastation that all of these deaths have been for families and loved ones. This is a terrible, terrible time. And I think we try to walk in someone else's shoes. And as a family doctor, I've done that for decades. But this is a really challenging situation. And my heart goes out to all the families who have been devastated by this.
Our next question comes from Sean Jeffords of the Canadian Press. Please go ahead.
Good morning, Minister. Can you hear me?
Yes, certainly can.
Great. Minister Fullerton, I'll just follow up on Lorenda's question there about the inspection. So it sounds like you have Ministry of Long-Term Care inspectors looking at these the report or the instances that were reported by the military. So that I just want to make sure I understand if that's the case, if that's what you're saying, and is this underway now? Because frankly, we understood a year ago that the Premier had asked for these investigations, and it seems as if they never happened. Can you tell us more about this? What's going on? When did these investigations start?
Well, there were inspections and investigations done at the time when this was unfolding. And certainly we are reviewing where this information came from, what is the basis and what is the source, and verifying. And I think that is a very important understanding, because there's a lot of information, a lot of discussion, and people say certain things, and we have to understand what the basis for that is. So we must verify. And so that involves the coroner's office. It involves our inspectors that were in the homes at the beginning of this pandemic, but also now. And our inspectors are in there now. We have multiple inspectors that will be in there for weeks. Again, understanding the correlation between the coroner's information and also interviewing staff and medical directors and people that were on the ground at that time. So we're trying to piece this together as to what really happened, and verify information that was said to the commissioners. So we have to be understanding what can be verified and what cannot be verified.
So, Minister, as a follow-up, I'll just ask again, we had the distinct impression from the Premier last year that when that military report was released, that there was going to be an investigation, that it was going to be referred to the police, and it appears that never happened. Why is that?
Well, the inspections were done, the investigation was done. We called in the inspectors right away. Premier called for an investigation, and that's why the inspectors went in. The inspectors did an investigation, and there was interaction and cross-reference with our other partners involved, and including the coroner's office. So that investigation was done. But it is up to the coroner's office to identify if there is evidence to call in the police. And the coroner has been involved in understanding the reports that it receives, death certificates, and that's what we're trying to do now, is understand where that information came from that was given to the commission, and on what basis was it provided. What do the reports say? What does the information have that correlates with the coroner's reports? And all of this has to be pieced together. It's not entirely clear to us where that report came from, or where the information came from that was given to the commissioners. So we're looking into that to find out. So certainly, there's no doubt that there were deaths. Certainly the causes, we need to understand what was reported to the coroner. So these inspections were done, the investigation was done, just as the Premier said. And now in the Commission for Long-Term Care, this has something else has come to light. So we need to look into and verify this.
Our next question comes from Lydia Chuba from CTV News Northern Ontario. Please go ahead. Lydia? Okay, we can move on and we'll circle back. Our next question comes from Jessica Smith-Cross from QP Briefing. Please go ahead.
We're really excited about our return to campus, because that's going to give us that access.
Sorry, sounds like someone else is unmuted there. Hi, Minister. I just wanted to understand if you believe the CAF members who raised the alarm about these deaths, and do you believe the other experts who've been saying for months or even a year, nurses, families, healthcare people, who've said that they believe that residents died of neglect during the pandemic?
Well, we have to understand what happened and verify the information that we are receiving. That's certainly what we're doing with the inspectors that are in these homes now. And looking at the coroner's reports and the information we have about this. So we need to understand what happened, what the reports and the information that we have indicate, and absolutely the devastation of loss that families have experienced. Absolutely, we acknowledge that. There's no question.
And to follow up, do you have any concerns about the coroner's process, given that these serious concerns have been raised, but until now, there have been no information referred to police concerning deaths from neglect?
Well, I think we have to understand what the inspectors find and found and correlate that with the coroner's information. All of this has to be investigated, and that's exactly what we're doing. And I think it's incredibly important to understand, what the families have gone through, what the staff have gone through, what the residents have gone through. And I very much appreciate everything that the Canadian Armed Forces did to provide assistance to these homes in their time of need. And I also appreciate the commissioners, what they've devoted for the last almost a year in terms of looking at what happened in long-term care. And I appreciate their insights, and I appreciate everyone who gave testimony to the commission. And so we are piecing this together and on the facts that we are finding. So the inspectors are in there. The investigation is being done.
The next question comes from Elaine Delamadia from the Sioux Star. Please go ahead.
Good morning. I'm going to circle back to Minister Romano if I can. Ross, number of acceptance letters will certainly be welcome news from colleges and universities. But, you know, nursing students is more than just about placements. There's also infrastructure that's needed at these colleges and universities to learn, for these students to learn, whether it be increased or more classrooms, lab sizes, additional instructors, etc. Do you anticipate the next step is that some of these colleges and universities that offer nursing programs to be asking for infrastructure money to upgrade their campuses to accommodate more students?
Well, thanks very much, Elaine, for that question. That's a great question. The way that the structure is working here and the way this was built was through Minister Fullerton's, like I said earlier, I really have to give a lot of credit to Minister Fullerton. They worked with our sector. We worked with the stakeholders. So we went directly to the providers and said, how many can we deliver now with the infrastructure we have in place? Because this was about current needs. We recognize the goal here is to address a challenge in the long-term care sector that exists now. So a lot of those more long-term goals that you're looking at would take a lot longer for us to be able to create that, to meet that gap in the system. So these individuals will be starting the program. These nursing students will be starting within the next 6 months. And so we worked with our stakeholders to ensure that they would be able to deliver these additional 2004 nursing students in this single cohort that now will travel throughout the entire system, through first year and then second and third, of course, and on and so on. But the real beauty of this wasn't just a random number that we picked out of thin air and said, we really want this many nurses. We're just gonna, 2004 is the number. It was worked with collaboratively to get to that point with our stakeholders. So that is why we were able to come to this conclusion. So to your question, this particular program that we're announcing here today, this will be based on the current capacity, the current infrastructure and ability we have to ensure that we could, within the next 6 months, have these students started as first-year students and move through the cohort and ensure that we could really address this health human resources capacity challenge in the time frame that we need to address it. So I hope that addresses the question. Again, this was really a matter of working out the numbers based on what the sector could handle at this present time.
Great, thank you. And just as a follow-up, certainly this kind of reverts back to the traditional learning methods. And we certainly know, Ross, that you're a big advocate of micro-credentialing program. Obviously, micro-credentialing is not something that I would imagine would train our nurses, but it could train some PSWs and support staff and whatnot. Do you anticipate further announcements or further program growth in these areas, which can also lead to supports to nurses and supports in our healthcare system?
I think absolutely we will see some additional supports coming through for the sector. If you look back now, over the course of the last about year and a half, the first move was to be able to create standalone degrees, as we referenced, for colleges in nursing. Then we were able to, addressing long-term care, Minister Fullerton was able to secure 16,200 new placements for PSWs in Ontario, 8,000 through the private career colleges program. Again, that was an $85 million program. Then you had the most recent announcement of 8,200 new PSWs through the public colleges system. It was a $115 million program. Another announcement here today with over 35 million to train these additional nurses. So I think what you're seeing is a very iterative process. We continue to move towards trying to address the gap that we have in our health human resources. You've heard me speak locally here in Sault Ste. Marie a great deal about capacity issues in healthcare and in numerous different facets of healthcare. Will micro-credentials specifically address those types of concerns? Will announcements of micro-credentials? In some cases, yes, but that's not the be-all, end-all. I think when we look at all of the supports that we've built, when you look at all the virtual supports even, although a lot of the clinical placements, obviously, these are going to occur in labs and in-person training, but a lot of the work that can be done virtually and allow people to work from home and to learn when and where they want to be able to learn and can learn, those are all important supports that I think transition very, very well to that future of learning that we have been speaking about, and really that not just the future of learning, but ensuring that we are really helping people to become lifelong learners, because as you've heard me say, I know that people will change careers many times. We know that now over the course of their profession. And there was a question earlier, Minister Fullerton addressed, of some students coming from other sectors and coming into nursing. We see the 72% increase of students wanting to be nurses. They see the demand, they see a great job. And I believe now with all of the investments our government has been making towards this sector, I think people are seeing some great opportunities to do something outstanding to help their community and the people locally within their community and across this province, but also to be able to have a great job at it as well. So I think there's a lot more to come, and there are so many ways that we're going to get there because of all the supports that we've been building over the course of the last few years now.
Thank you.
The final question will go back to Lydia Chubak from CTV News, Northern Ontario. Please go ahead. Lydia, are you there?
Here we are. Can you hear me now?
Yes, we can.
Okay, sorry about that. I'm juggling a few things here at the same time. So my question is for Minister Fullerton. And I'd like to know, of all these nurses, are you going to make sure that there are nurses that can get into have addictions training and have training for community care? Because in Northern Ontario, we are seeing, high opioid overdose deaths. We're seeing people who live in the community who are not getting the care that they need. People who can't get out of wheelchairs, who can't feed themselves, and they're not getting the nursing care that they need. So how are you going to ensure that out of all these nursing students, some can be directed to go work in community care programs and to go work in hospitals to offer medical treatment for people dealing with substance abuse disorders?
Yeah, thank you. It's a very important question because we look back and the investments in training more nurses just wasn't done over the last 15 years. And so now we're playing catch up with an aging workforce, with an aging nursing workforce. And you point out, a very important area of suffering, which is addiction. And obviously, when we start these programs, and you heard Minister Romano outline them, I won't go into that again. It is a step forward. It is a step forward to addressing the long-standing staffing issues, not only in long-term care, but throughout the system. Because, if we look at any part of the system, whether it's long-term care or, mental health and addictions, it's all part of a very complex healthcare system. And so by creating more of these training opportunities and training positions that are very much needed, we are creating a supply that will eventually go to many, many different areas, because people have that choice as they train to become a registered practical nurse, a registered nurse. They have the choice of where they want to be. And so as we move forward, and I know there's Associate Minister Tobolo of Mental Health and Addictions, and working with the Ministry of Health, obviously that's an area of concern. So very important question. Thank you.
Follow up?
No, that's fine because the audio isn't very good from the minister actually. So I'll leave you be for now.
Sorry about that. Thank you.
Okay, great. So we'll follow up on that, but that concludes our announcement for this morning. So thank you everyone so much for joining us.